In this video, I'll be showing how to create a task template. Now, we'll go to templates, and I'd like to show you how to do a task template for investigation. So one of the ASAP maneuvers is for mammograms, so this is a pretty common one that we'll be dealing with, so I'll show how you can create a task template to make sure that when you order a mammogram, it codes it properly and categorizes it so that you can search for it later. So again, this is a template that we're creating, so we will only have to do the settings once, and then in the future this can be used in each individual patient's chart. So from the templates menu, we go to the investigation tab, and we say plus new. So because we went through the investigation tab, the category is already set to investigation, and it's very important to use a type. So this site that I'm on has a lot of options already created, but you can always manage the list by hovering beside type and a file box appears. I would just make sure that this list maybe is limited to a few people and is very carefully crafted so that there are no duplicates and nothing that can be confused with anything else. So once you have the category and the type in there, let's put the template name, and I usually just duplicate what the type is, because usually that's indicating the kind of report that's going to be attached here. Now, I know I've seen a lot of clinics use description as a way to search for these reports later, and they'll have a set phrase that has to be typed in exactly in order to search for it later. So this is why instead of that I use type. It's a lot less likely that someone will make a mistake by selecting or even using this template where they don't have to select anything at all. So if you want to use description, just know that it's for visual purposes only. I know that it does look nice to have something in this field when looking at a patient's chart, but just remember, visual purposes only. And the last step would be to find the observation template. So this is the requisition that you'd like to use. So there are a lot in this list, and most of them are developed by MedAccess. But let's just find one that we know, RCA Diagnostics, and we can hit save. So in a patient's chart, if you're wanting to order a mammogram, you go to their investigation tab, and instead of left-clicking on requisition, right-click. And you can see these task templates that we have created. So here's our mammogram. And you can see that the category and the type pre-populate, and this is very important for reporting and categorizing. And then on the right-hand side, you can see the requisition. So you can select whatever the test is that you're wanting to do and hit save.